Hello. Good afternoon,
Alors,
everybody.
donc on va passer à la prochaine présentation qui va être présentée par Dr Ghotra et qui va porter sur sur le lipolyse laser, une approche peu invasive pour des résultats optimaux dans le traitement du double montant et du cou. À vous la parole, Dr Ghotra.
Okay, my name is Ghotra, and I'm a practicing aesthetic physician working in Amsterdam. And we mainly focus on the holistic approach. Dr. Kuldeep Minosha have really set the background for my presentation, actually. I would like to thank him, where he spoke about the use of the dermal fillers for the facial rejuvenation and augmentation. So I'm working in a aesthetic clinic close to Amsterdam, and our main approach is the holistic approach. I think the world is moving towards the holistic approach, meaning we are targeting all the skin layers, whether you are talking about the bony layer, or the deep fat pads, or the SMARS layer, or the skin layer, to make a nice treatment plan for the patient. Because in our opinion, and also if you look at all the research articles, it's in the best interest of the patients. So I'd like to thank Spectra to invite me to share my experience with the dual wavelength lipolaser system. So I will take you through how the lipolaser system works, but for me it's really important to know in the audience, with one simple question, how many people in the audience are using the laser lipolysis system in their clinic? Maybe you can raise your hands for me. So I only see 1, 2, and 3 people, clinicians in the audience who are using the laser lipolysis system. So it gives me more idea what I have to talk about it. So I will start something about, I will try to tell you, to take you along why you really need a laser lipo systems in your clinic for the best interest of the patients. So how the optics of the laser lipolysis works, which wavelength is really important, depending upon the aesthetic need of the patients, what are the advantages of the dual multi-wavelength systems in comparison to the single wavelength systems, what is the concept of the thermal volume, because thermal volume is a critical parameter for the aesthetic planning in the laser lipolysis. And then I will talk a little bit about the indications, a little bit about the treatment planning, and then I will give you some take-home messages, which I would say is really important to really understand the system. So I will start with the basic concept of the laser lipolysis. If you look at the laser lipolysis over any other form of the laser systems, so it depends on the absorption coefficient of the tissue that you're going to treat, the scattering. So for example, if you're putting a laser coupled to the diode optic fiber system in the adipose tissue, so the photons of the laser could have multiple things it could do. For example, based on the wavelength and absorption of the tissue will take up the photon, and which leads to the heating up of the tissue. Meaning, some of the lasers, some of the wavelengths have high absorption coefficient for the fat tissue. And there are some of the lasers, diode coupled lasers, which have the low absorption coefficient. So if you put the laser, if you put the fiber optic coupled diode system in the adipose tissue with a low wavelength laser, so it will be less absorbed, but it will travel more. So what I want to stress, if you're taking the higher wavelength system, for example, 1470 nanometers, the laser light is going to travel less in the tissue because it will be directly absorbed by the tissue, and it will scatter less. So this is a correlation. So the higher wavelength system has more absorption and the less scattering. So it means they tend to cater a very small thermal volumes. Now I'm going to introduce the concept of the thermal volumes. So the thermal volume means what is your clinical volume that you want to treat. So the small thermal volumes means, for example, we rarely see many people who are having the infraorbital fat bulgings. So they are very small critical thermal volumes. Jowls are also very small thermal volumes, a little bit bigger than the infraorbital fat pads. So what I want to stress, wavelengths which are on the higher side are really suitable to treat the areas with low thermal volume with high risk. Infraorbital region is a high risk area because the eyeball is in the vicinity. Major neurovascular bundles are in the vicinity. So you can really heat up the tissue and you can do the selective lipolysis and with lesser risk. But you have also higher thermal volumes, for example, people with submental fat tissue, there are different gradings. Some people, they have really high thermal volumes, really high fat tissue, and then you tend to choose wavelengths which are shorter so that they can travel more and they scatter more, so that you can treat the bigger thermal volumes. So that's the strength of the multiple wavelength systems. So in the market, you have some systems which are just scattering on the single wavelength. Either you can use lower wavelength systems or the higher wavelength systems. This is a nice graph from a group from JAX, where they show that if you increase the wavelength of the diode laser used, then it will lead to less scattering and the more absorption. But on the lower wavelength side, if you look on the X and the Y axis, they tend to travel deeper, and because they scatter more and the absorption is less. So they tend to scatter more higher thermal volumes. So this is a nice comparison of different wavelengths that are used in the market at the moment. Most of them, there are also other wavelengths, but I will focus on the four main wavelengths. 915 nanometers, 980 nanometers, 1064, and 1470. If you look at very critically, if you move from 915 to 4070 nanometers, the fat absorption coefficient of the wavelength increases. So the fat absorption is very high at 4070, but it tends to scatter low. So it means it's very superficial. And the wavelength on the lower side, 980 nanometers, they have the moderate level of penetration and moderate level of absorption. So it means they tend to treat bigger thermal volumes. So the question is which system to choose? So for example, if you have a patient who has infraorbital fat bulgings, they have the jowls, they also have intermediate level of the submental fat, then you can use the multiple wavelength systems to treat all the clinical issues with one machine. But there are some machines in which you have only one option. So it means you are bound with one wavelength because you can't treat everything within one wavelength. So that's the strength of the multiple wavelength systems. And also the superficial wavelength systems, so it means which are treating the small thermal volumes, they tend to create also more skin tightening because they are very superficial, and also the dermal collagen is also gets stimulated in that wavelength. And it's also, the absorption coefficient is water is also nearly very high in the same region. There are some patients who don't have any volume increase in their face, but they have only the sagging. They don't have any submental fat. The jowls are sagging everything, and they have very thin skin. So it means in that case, you can think of using a wavelength on the higher side in that case, because you don't need a lower wavelength in that case. In comparison, think of a client who have very big submental volume, the jowls are hanging, and she has or he has an infraorbital fat bulging. And then you need a combination. You need a 4070 for this, and you need a 980 nanometers for this area. So that's the beauty of the multiple wavelength systems. So we have already spoken about it. If you in the upper area you see a laser fiber, diode couple laser with the 1980 nanometers. So what you see, the red area is the amount of thermal volume it's gonna treat. So in that thermal volume, you expect a lipolysis. If you look at all the research publications, for effective lipolysis, you need a temperature of 55 to 65 degrees in the tissue itself. And with the 4070 nanometers, you have a small thermal volume. So it's very nice and safe for the patients who need just to treat very small thermal volumes, because it's very safe in that case. So here I'm going to focus it how you can use a dual multi-wavelength systems in a patient. So you have two options with the dual wavelength system. So you can use an endolaser system. You can just use a bare fiber. You do a local anesthesia with 2% lidocaine. You mark the area. I will tell you how you mark the areas. It's one of the most critical point in treatment planning of the patients who come for the laser lipolysis. And you can use a small flexible fibers. Either you can use 400 microns or 600 microns. Also, availability of 300 micron is also there. So for example, with the small, thin fibers, the laser beam is very concentrated. So you are very safe for the small thermal volumes. For example, infraorbital fat bulging. Most of the clients, they go to the plastic surgeons. Sometimes you do need to send to the plastic surgeons. But sometimes you can easily treat those patients with the endolaser, with the very small fibers, 300 microns, targeting the small thermal volume. Now the question is, in the same settings, you can use the same fiber also for treatment of the big thermal volumes, like submental fat. So what you need a handpiece, and you need a metal cannula. So you can insert, if you look here, you can insert the fiber. For example, you have treated the face with the 600 micron fibers for the skin tightening, and then you also want to treat the under chin of the submental volume. Okay, then what you do, you pick up the cannula, you put the fiber inside, and you're going to start with the 980 nanometer lasers. So that's the beauty of the system. So you can combine multiple things in one go, which helps to decrease the cost of the treatments. And you can make a nice treatment plans for the patients. Because some of the patients, they come for one indication, and some of the patients, they come for multiple indications. And you can also think of doing it in one go, or you can plan it sequentially, depending upon what the patient wants to achieve. So I'm going to pick up one clinical scenario of the submental fat. If you look at very carefully, the submental fat, there is a great submental convexity scale, concavity scale, which has been published, and all these slides are based on that parameters. So if you look in the grade 0, they don't have any submental fat, but in the mild grade, you have a grade 1. So those patients are really good candidates with a higher wavelength, 1470, because the thermal volume is very small. But in the case of the large thermal volume, like grade 2 to 4, the patient has a big, high collection of preplatysmal fat, and you need to treat a big thermal volume with a wavelength that's able to penetrate and scatter, creating a bigger thermal volume. Okay. So I will give you one example of the patient. I will try to tell how you can mark the patient and how the endolaser procedure works. For example, it means that aim in this case, if you look very critically in that patient, she has a ptosis of the inferior jowl fat compartments. So the thermal volume is really small. So you don't need to use a 980 nanometer laser in that case. You just need to use a higher wavelength laser to treat that small thermal volume, because you are very focused on that areas. And also, you also need a skin tightening. So you can do two things with 1470 nanometer multi-wavelength system in this patient. So what we do for the treatment planning, you take this treatment planning has been based on one cadaver study in which they try to anatomically mark the inferior jowl fat compartments. I have also put the reference up. So what you do, you take a point from the oral commissure to the pre-jowl sulcus. We do it normally. And then you take 1 point from the antigonial notch. Kuldeep Minosha has already told you about the gonial point. Just anterior to the gonial point, you have an antigonial notch. You take a 1 point from that and extend the point to the lateral icanthus. You draw a vertical line. And then you draw another line from the middle of the labial mentosulcus, extending it to the earlobe. So in this way, you can mark the inferior jowl compartment. So what we do, we use these markings for majority of our treatments. Also, for the thread lifts, we do it. With the aptos, we do it. Some people they have. So sometimes you need a combination treatments. So this is a really great marking technique to really mark the jowl compartments. And to mark the submental fat, you take a 1 centimeter point below the jaw angle, and you need to have a 1 horizontal line above the thyroid cartilage. And then you join all these lines. So it means you have the submental zone, you have zone below the jawline, and you can decide how much energy you want to put in the patient depending upon what the patient needs and what the requirement is. So you put the local anesthesia, 2% lidocaine per zone. You can also combine it with adrenaline. You do a sterile draping of the patient. It's really slow. And then you use a fiber, optical fibers. In one go, the idea is to treat that small thermal volumes. So in that case, we use a dual system. So what you see, we use 2 wavelengths, 1417 and 9080 nanometers together. So 2/3 of the energy was coming from 4070 nanometers, and 1/3 of the energy was coming from 980 nanometers. And then you can combine it to treat that thermal volume. So with that fiber, with the thermal fiber, with the optical fibers, you reach the jowl fat compartment, and you fire the laser, and you fire the laser only when you are retracting the fiber back. If you are going to fire the laser when you're putting the fiber inside, because the fiber is flexible, it can buckle it up. So it can lead to a lot of injuries. There you have to be careful about. It's not moving. Now for the follow-up, the patient has to wear the neck drape for at least 48 hours, and then she has to do some lymphatic massage after 48 hours. So I think there are different protocols. So what we do for 2 days, patient has to wear it, and after 2 days, we advise to do some lymphatic massage, and we follow the patients for 2 weeks, 6 weeks, 3 months, and 6 months. So there are multiple publications on this concept that after the laser lipolysis, the optimal effect is achieved after 6 months. So that's my advice to you, to do follow-up till 6 months so that you can generate a lot of data. So these are the results after 6 weeks in that case. So what you see in that case, the jowl compartment is shrunken a little bit. So what we did in her case, we did a holistic planning, and she underwent for the TCA peelings because she had a lot of hypertrophic photoaging. We saw a lot of superficial pigmentation, depigmentation, to make some holistic planning in her case. So this is another example of the treatment of the submental fat. So if you look at it very carefully, it's a mild grade, and she was treated with the endo laser with the 1470 nanometers. So the potential complications redness and the swelling is seen in majority of the cases. And in 15 to 20% cases, we see a neuropyrexia of the marginal mandible branch of the facial nerve. I have a great case to show you how it works. So for example, on the day 1, you see that the patient had a little bit bruising in the submental area. But if you look at clearly, the left side of our face has neuropyrexia of the marginal mandible nerve. Do you agree with me, or is right side? It's left side, yeah? Because when she's smiling, the lower lip is not coming down on the left side. The right side is coming down. It means there's a neuropyrexia on the left side. So most of the time, in 2 to 3 weeks, it recovers. But sometimes the patient, they really are very much concerned. They have some important, they're working, and we need to do something extra. So what we did a 2.5 units of the dye spot on the active side of the depressor anguli oris. And if you see on the day 10, it was she was really quite happy and with the effect, and the smiling was symmetrical in that case. So what I want to stress, if you use this technology, you should also know how to treat the complications. This is really important. Otherwise, don't use this technology. You really need to have from A to Z how the treatment planning works. You need to know how the laser works. You need to know how you're going to treat the complications. Because if you are a specialist who is treating the patient, you are also responsible for treating the complications. Definitely, you already have colleagues around you which have a lot of experience. You discuss with that, and you go further. So the key takeaways are shorter wavelengths showing intermediate scattering and intermediate absorption in adipose tissue are really effective for the large thermal volumes. It means higher level of the submental fat. Longer wavelengths showing low scattering and high absorption are really suitable for the small thermal volumes. Jowl fat, infraorbital fat bulging, and mid-grading of the submental fat. So my message to you is, if you want to invest in this technology, go for a dual wavelength system. It has a higher initial investment, but on the longer run, it will give you a return of investment. So I will thank you for everybody. So if you have any questions, you can ask me, or maybe we can do it. 36 years old, and she has a very mild submental volume. If you look at very clearly, she has a small thermal volume, which I was stressing there. So she's not a candidate for the 980 nanometer lasers because the thermal volume is on the lower side. And in the young patient, it's best to have a 1470 nanometer laser with a very mild thermal volume. So we're going to use, okay, maybe you can put her here. Yeah? Sorry, just a minute. So she's a candidate only for the small thermal volume with 4070 nanometer lasers. I'm going to put the protective goggles for you. Yeah? Okay. Okay, just a minute. Okay, maybe come a little bit. Asma? Okay, perfect. Okay, so we have a 3 meter fiber system. Is an optical fiber of 600 microns. So with this optical fiber, you can do also the bigger thermal volumes. You can use a 980 nanometer laser, and you can also use the 1470 nanometer lasers. Or you can also combine it in one setting. So you can also use just the endolace treatment, and you can also put it through the hand and the cannula. Just a minute. So we're gonna attach the optical fiber. So this optical fiber has 3 coatings, if you see. So it has an internal coating of the quartz. It's made of quartz, and then you have a resin layer, and then you have a silica layer. So it means you can easily remove the silica layer because you first gonna do the endolace procedure. So you just do it, and then you remove it. Okay. Can you provide me with the goggles if you want? Just a minute. So the laser is not so firing anymore. Okay. So what I showed you in the presentation, we marked the patient the same way. I have also marked the jowl compartment for you, but we're not going to treat the jowl because she doesn't have any ptosis of the inferior jowl fat pad. So you see the lateral canthus till the antegonial notch, another line from the earlobe till the labiamental sulcus, another line going from the oral commissure to the jowl sulcus. And you can extend this line vertically to mark the lateral area of the submental fat. And also on the same side, on the other side, we did it. So we have 3 compartments here, which we are interested in. The area below the mandible angle, and also the submental area. So we have 3 areas, 1, 2, and 3. And based on our experience, I would go for at least 400 to 600 joules energy for the submental area, and 300 to 400 for the area below the mandible. So in this way, we can do a treatment planning, and we can decide how much energy we're gonna do in this case. Okay? So we're gonna first start this area. So the patient has been, I forgot to tell you, patient has been already anesthetized. So we used 1 to 2 ml of the 2% lidocaine, and she has waited for 20 to 15 minutes here, and she has been properly anesthetized, and we will see how it works. Okay, Asma? So I want to use, you can also wear the, if you want, the gloves so that you can assist me in that. So you can wait a minute. No, it's not firing. It's okay. Don't worry. So I'm gonna make a small puncture here. Okay, just a minute. And you have always a foot pedal to control the firing of the laser. Okay. So if you see, this is a 4070 nanometer laser, and the LED light is guiding the laser fiber, the optical fibers, and I only fire if I retracted retrograde. So you have to be very careful that you don't build up the energy around the opening. Because we punctured it, the area. Can you look how much energy has been used? Total energy? Joules, eh? Perfect. So we're gonna go for 400 joules in this area. 400. Are feeling okay, Asma? So I fire the laser only in a retrograde manner. I don't fire when I'm pushing the fiber inside because it can buckle. And for example, if somebody has a lot of high thermal volume, it's not handy to treat the people with the fibers because your hands get tired, your fingers get tired, and it's not practically feasible. So you need a metal handpiece or cannula to hold the handpiece. So that's the beauty of the dual wavelength systems. Can you look at how many? So we have already reached the 264 joules area in that region. And we're using a power of 6 watt. And we're using a combination. So the 4 watt energy is coming from the 4070, and 2 watt is coming from the 980 nanometers. So 6 watt means it's firing 6 joules per second. In this way, you can also calculate the treatment time. So that's what I say, treatment planning is a very critical factor in these treatments. Feeling okay? Okay, we have reached 400. Okay. So I will go a little bit superficial, close to the skin layer, a little bit. So at the junction of the dermal subcutaneous layer. So I will dump 50 to 60 joules, which can cause extra skin tightening. So you have to be very careful. Okay. Can you give me a swab? So we can you give me a swab? Feeling okay? Okay. So Asma is really brave. She has done only till now a little bit in lip augmentation in the past, and she just wanted to give a go to have a better jawline. Now we're going to treat the submental area. Will be done. Okay. I hope. Okay. Can you put it a little bit flatter for me? The head side. Yeah, this. Yeah, please. You're doing the foot side. Perfect. Do it a little bit more, little bit more, little bit more. Perfect. Yeah, okay. Now, now we're going to treat the submental area. Just a minute. So the puncture opening is closed now, so I'm gonna have to do it once again. This is here. Maybe you can assist me here. Okay, you can carry it here. Okay, be careful. Generally, the capping is not allowed in the medical settings. So we're going to do it now 600. So you have to do a little bit addition for me. Okay. Just take it. Okay. Just be careful. It's hard, Elizabeth. Better? You're doing good, Asma? If anybody has any questions, they can ask. Or you can also meet me afterwards at the Spectre stand, and I can go through the whole of the procedures. Feeling okay, Asma? Sometimes you can also do the temperature control using the infrared cameras or thermometers. But in young patients, I don't find the need to do that. Only in the people who have, only the patient who have a very thin skin, my advice is don't do without the temperature control.
You have 4 minutes left, Dr. Ghotra.
Okay, I will do my best. Okay, I'm gonna go to the other side. Can you give me the pedal, field folks? Yeah, okay. Put this here. Yeah. Feeling okay? Asma? Okay, I'm looking for the pedal. Okay, I have it. So in my clinic, we do, the position is different. Feeling okay, Esma? So okay, you feel hot. Okay. So I think we will just use this. We just do this area and then we can do the rest later. How much energy has been used? Can you check it? In total now.
Docteur Ghotra, on va vous laisser terminer tranquille et on va quand même remercier le docteur Garcia Maria. Vous pouvez venir s'il vous plaît.
Yeah.